colleagues from MDHHS here. Carrie and Robin Orsborn are here. And with MPHI, this is Julia Heaney, and I'm joined by Lauren Lepine and Aaron Mann. Before we go any further, I want to make sure I congratulate you on your completion of steps 1, 2, and 3. We've been reading through what you sent in, and we're so excited to see the ways that you've engaged your community members, the way you've identified families to participate in your process, the great vision statements you've come up with, the value statements that you've articulated. It's really exciting to see all of the thinking and work and engagement that you've done over the past month to complete those first 3 steps. We're really excited and proud of the work that you've done so far and are looking forward to jumping into this next piece of the assessment process with you. So today we will again give kind of an overview of where we've been and also where we're heading, sort of general model and approach that we're working within. And then we'll talk about really specifically the second assessment. And I'll talk about why we're talking about the second assessment before the first assessment when we get there. But today we'll be focused on steps 4 and 5 for the second assessment. We'll talk about next step, and we'll take any questions that you have at the end, as well as throughout our discussion today. If there's any point where you want to jump in and ask a question, there's a chat box that you can write in to let us know that you'd like to either speak or that you'd like us to answer a question as we go. Last time we asked you to hold your questions till the end, and we just felt a little bit worried that that might have been missing questions along the way. So we want to invite you to ask questions as you have them, and I will do my best to pause through the process as well to invite your questions as they come up. So here's where we are in our process. You have gotten yourselves organized. You've thought about who's going to lead this work, who you're going to invite to participate, what groups you have to build. Also, to complete this process, you've figured out how to engage parents and family members and community members as partners in the process. You've done your invitations of your partners to participate, and you've completed a vision statement and value statement. So that's awesome work, and it has, from what we're seeing, really set you up for a very successful process. The next steps of the process involve gathering assessment information and interpreting your assessment data. So the way we're going to move through this process is we're going to ask that you kind of complete steps 4 and 5 sequentially. So as soon as you have data, we want you to look at it, interpret it, decide what it means to you. We'll talk about sort of a strategy for doing that as we go. In this model that we're using, there's 3 types of assessments that we're recommending. For those of you who are familiar with NACCHO's model, you'll know that there's 4 assessments, and we've pulled out only 3 of them to focus on for just time and resources, but we think that you'll be able to cover a lot of ground through these 3 assessments. So the ones that we'll be using are the community themes and strengths assessments, which is what we'll be talking about today. We'll also have a maternal and child health status assessment that will focus more on population data, and a maternal child health system assessment, which will focus more on the way that you work together with your community partners to deliver the essential public health services from a maternal child health perspective. Just as a reminder, the reason that we include multiple types of data collection and data gathering activities is that that's really the definition of an assessment. An assessment involves looking at the same question from different perspectives in order to have a more complete picture of maternal and child health in your community. It's just, like the proverbial elephant, where if we're only looking at population health data, that's going to tell us about a lot about health outcomes and health behaviors at a population level, but it's not going to tell you what your community looks like and feels like to the people who live there. That's why we have the community themes and strengths assessment, to give us an opportunity to listen to people who live in your community deeply to where they are in their perceptions of what supports health and what hinders health for them within the community. But that sort of assessment doesn't tell us about those deep systems, forces and factors that kind of create the conditions which people can be healthy or not healthy within a community. And so that's why we do the system assessment as well. So these 3 assessments together give us a different view on that proverbial elephant and help us better understand as a whole what maternal child health looks like within a community. typically when we do this process, we start with the maternal and child health status assessment where we're looking at population data. This time, we're starting with the community themes and strengths assessment, and we're doing that for two reasons. First of all, we have a great team of epidemiologists at the state who are working really hard to pull together as much local MCH data as they possibly can so that we can hand that over to you and you won't have to do a lot of digging into data that are, at least state-level data that are available on maternal child health issues. We're really excited to be able to do that, and the EPI staff have been working really hard to pull that together. They need a couple more weeks, and we need a couple more weeks to kind of summarize and put that together in a package for you. So we're putting that assessment into our second assessment, focusing on community themes and strengths first. The other reason we're doing that is that community themes and strengths is the assessment where we're asking you to collect original data for your community, and so that is a little bit more of a time-consuming process. You have to do a little bit more planning, actually collect the data yourselves, and so that this will give you a little bit more time to go through those steps and complete that process. So we think that this ordering will work really well for everyone, but want to give that background because I know it's fairly typical to start with the health status assessment to begin with. So today we're going to be diving into community themes and talking about what that looks like and talking about some options available to you for completing that piece of the assessment. So as a reminder, we are following a life course model as we think about this assessment process. So as it relates to our community themes and strengths assessment, we want you to think about how you can learn about what health looks like across the life course for people in the community. We're again just flashing up this slide that shows the stages of the life course and sort of is intended to reinforce that idea that when we see an outcome in adulthood, that's founded on lots of experiences and exposures that happened before adulthood. When we see something that happens in adolescence, it's founded before adolescence, and can even be founded in the preconception or interconception period with that idea that what's going on with individuals' health is related not only to their own personal history, but the history of families as well. We're also basing this assessment around the idea that outcomes are underlies health outcomes are a whole series of broader forces and factors that we have to consider. So we know that there's a relationship between health behaviors and health outcomes. If you smoke, then you're more likely to have cardiovascular disease, more likely to have lung cancer, and so forth. But I also know that there's broader forces that underlie health behavior, such as social determinants of health. So you might be more likely to smoke if you're living in a very stressful environment, or living in an environment where smoking is common, or where you're exposed to smoke in a variety of settings within a community. We also know that health behaviors and outcomes are related to the direct and enabling services that a community member has access to. So if you have really access to smoking cessation services, or you have prevention programs around tobacco use, then you might be less likely to smoke than if you live in a community that doesn't have those services. And with even more broadly, our public health systems can support different health behaviors and health outcomes that when you live in an environment where you have really strong policies around taxation or around smoking in public places and that sort of thing, then you see less smoking and less of those outcomes that are related to smoking. So that model into this conversation and asking you to use kind of that lens as you're talking with community members about their experiences and exposures and perceptions of their community. So community themes and strengths assessment, diving right in. The purpose of this assessment is to gather input from community partners and community members about features of the community that support health and features of the community that put health at risk across the life course, and health needs and concerns during each stage of the life course and for children and youth with special health care needs. These are really big questions, big purposes to fulfill, and we're really just asking you to kind of take a glimpse into this. You don't have to bite this whole big question off. bite off piece that's chewable for you, that's doable for you, and we'll help you think about how to focus that as needed. But the real intent here is to listen deeply to community members about their experiences within your community that support health or put health at risk. There are lots of opportunities to engage your partners throughout this assessment, and we'd invite you to think about the ways in which you'll engage your community partners through this assessment, those partners that you brought together through steps 1, 2, and 3. Sometimes what we see is that communities will form subgroups to complete this assessment, they won't necessarily include every single person on their broader community health committee, but will focus on a smaller subgroup that has interest, skill, capacity, that kind of thing that is a good fit for this particular type of work. So you'll have to think about that. Who makes sense to participate in the process? You'll also think about engaging your community partners in the process of deciding what to focus on. So we'll talk about the various options for what to focus on in just a minute, but listening to your community partners can be helpful in figuring out where do we have gaps, what do we really need to know more about. You also involve your partners in the data collection process. We've had experiences where partners had access to interns or had access to students who were really helpful in doing some direct data collection, or partners who had settings where families or children often convened, like a school, for example, or particular types of clinics or other settings within the community, early child care settings, where you could gather information from the population that you're interested in. We encourage you to include your partners in developing key findings. We'll talk again about what that looks like in a few minutes, but your partners can provide insight into what the data that you're collecting really mean for your community and how to make sense of what you're hearing. So it's an opportunity for community partners to be engaged throughout this assessment. So as you're thinking about what to focus this assessment on, you have a couple of options. And focus very broadly on the concept of community themes and strengths. So asking really broad questions about from a maternal child health perspective, what supports healthy development, what supports health, maternal health, what are factors in your community that put health at risk for this particular population. You could also dive more deeply into a particular area of maternal child health where you might know already that you don't have particularly good population data, or about a population group where you know there's a big gap. So for example, you might know that you don't have really great data on sleep practices within your community, and so you might decide to focus your listening activities around safe sleep to learn a little bit more about that from the perspective of community members. Or you might recognize that middle childhood, that elementary school period, early middle school period is a time where you don't have a lot of data about what's going on with health for that particular population group. So you might want to focus on kiddos in that phase to dive more deeply into that area. So it's really very much up to you, up to your partners you've engaged to explore this question of, do we want to ask some questions about maternal child health in our community and get some kind of big picture ideas about what this community is like for mothers and babies and children and adolescents? Or do we feel like we have that sort of sense and we want to dive more deeply into some particular aspect of health or some particular population group in order to get information of an area where we know we have a gap? And that's completely up to you, the decision that you make. But again, an opportunity to engage your partners in thinking through what that might look like. When you see the tool, we'll be sending out this section of the tool after the webinar today. And when you see the tool, you'll see several questions listed that this type of assessment is intended to answer. So you could look to answer a question like, what do you believe are the 2 to 3 characteristics of this community that promote health across the life course? What are some of the specific examples of people or groups working together to improve maternal and child health in your community? What do you believe are the 2 to 3 most important issues that must be addressed to improve health across the life course? What do you believe is keeping your community from doing what needs to be done to improve maternal and child health? What actions, policy, or funding priorities would be required to improve maternal child health in your community? So you can see in these questions, these are big questions. They're open-ended questions. They're questions that are intended to not to give a pointed answer, but to generate some dialogue and some creative thinking and some and to gather community perspective on health from a sort of broad and big picture perspective. You can see in some of these questions, they're also pointing out aspects of the community that are more systems level challenges that that could be identified from the perspective of community members. Another thing to notice about these types of questions is that we're not only looking for problems, we're looking for strengths. We're looking for what is available in your community now that could be built on. So, for example, the question number 2, that we're asking about people or groups that are already working to improve maternal child health. Where are your assets? What can you build off of? So in order to complete this assessment, you'll be gathering original qualitative data from community members. You could also use existing qualitative data that you've already collected at your organization or from your partner organizations. Many options for collecting data. And what, again, we'd like you to think about is selecting an option that aligns with your capacity. If you have time and space to do several different methods, then that's awesome, and we'd love to see what you come up with. If you have time and space to select one of the methods that we're talking about and go forward with that, that's also perfectly fine. We want you to fit this in with what makes sense for you and your community. We want you to select a method that makes sense within your community and addresses questions that are important to you, that you want to have answers to around maternal child health in your community. We're going to be talking about several options for collecting data, but I want to return again to I'm not sure how clearly I said this a minute ago, just to reinforce that idea that what we're asking you to do is select one method, select one data collection activity that's important to you, that fits with your capacity, and to move forward with that. If you have the capacity to do more than one, that's great. If you don't, that's also perfectly fine. So we're really only asking you to select one and then build from there if you can. So before I move on, I know that many of you have already collected open-ended qualitative data from your community members using various methods, and I'd like to pause for a second to invite any of you who have experience with this type of assessment to share what you've done and maybe some of your lessons learned. I think that someone might have put us on hold and we're hearing their background music.
Please stay on the line.
So I think that since we're on hold, maybe we're going to mute everyone again, and we'll actually invite you to, if you have, can we unmute people one at a time? Okay. If you have something you'd like to share, if you could type it in the box, and we will unmute one at a time instead of everyone all at once. To give my reminder that please don't put us on hold because we get the music, and please do mute your phones. So anyone jumping in share that we can see at least on our end in the chat box, which is fine. I think that we have probably more discussion as we jump into particular examples of data activities. Go ahead and talk about one of your first options. So this option, we call it a community input wall. And this is a really simple, straightforward, low-cost, low-intensity way to gather perspectives from community members or people who frequent a particular setting about their sort of general perceptions of what makes a community healthy or what puts a community's health at risk. You can see on the side of the screen example of a community input wall. This can be set up a lot of different ways, and I think that we have some other examples of ways that this has been set up on a subsequent slide. But the basic idea is that you put up a large piece of poster board, a sticky wall, just whatever is sort of available to you, and give community members the option to respond to a question and write an answer. And let's see, let's flip to the next slide. Yes, you would post that large piece of paper, sticky wall, poster board in a location where it'll be seen by community members and or clients. So you could put these at a public event. You could put it on the wall of a clinic, set it up in a school, a child care facility, really anywhere where you or your partners know that that community members will be walking by and will see it and will have the opportunity to respond to it. You'll want to make the wall large enough to gather quite a bit of input. So 6 feet, 4 feet is a good target, but it should be fairly large. You'll want to divide that piece of paper into sections and write a key question at the top of each section, and we have an example question here. What about our community helps families stay healthy? And you might have another question about how could our community be improved to help families be healthier, something like that. Then you can leave markers or sticky notes near the wall and encourage community members to write down their ideas. We have done this in communities where privacy was a concern, and in those situations, we've asked them to do basically a feedback box, so a lock box with notes next to it and or paper next to it that community members can use to write a note and stick it in the box so that others can't see what they wrote. But this is a nice, very, very visual way of gathering feedback from your customers, from family members and community members about health within your community. We typically, when we've done this, we've had the folks who are at the front desk or are otherwise sort of near the wall encourage people to write on it. Usually it kind of takes that prompt to get people to write it, especially the first several notes. But in our experience, once it gets rolling, the input piles up. So again, a really straightforward, simple, easy way to gather feedback from lots of different people in lots of different settings. And we have a really awesome example from Barry Eaton, and Ann Barna, I think, is on the line and willing to share what their experience was in using this particular method to gather community input. So then, are you unmuted? Are you able to speak?
Can you guys hear me?
We do, Ann.
Yeah. Okay. So I wanted just to explain Health Capital Counties is our community health assessment and improvement process for Ingham, Eaton, and Clinton counties. And we partner with Ingham County Health Department and Mid-Michigan District Health Department on this project. So to give them kudos as well for helping with this. So we, last year in 2015, I think we had, I want to say 7 or 8 different wall locations and different kinds of events that we did this at. And we did it a couple different ways. You can see there was a sticky wall where basically it's the fabric that you spray brown and paper to it. It's really fun. And then we also did like block paper, the kind of paper that you use on bulletin boards. And then also you can see that some easels there. And did it at health fairs where people be walking by and you can kind of engage them and pull them in. And then we did it in more sort of passive locations, and it would be up for a week or 2 weeks, and we get input that way. And so really the key thing is that, you know, you had to try to explain it to people because so many people had never seen it done before. And then, you know, somebody to organize it, go put up, and then go take it down. that was pretty much about it. And then there's the whole analysis part afterwards of the input that people gave. But it was really well received by some of our hospital partners, especially. They really liked being able to engage regular people in the assessment process. So that's definitely an option. And then also just, opportunities once you start looking around, I think.
And could you talk a little bit about the way you approached analysis for the community input walls that you did?
Sure. So Susan is our health analyst, and she put her, this is a example of a word cloud. So word clouds, the basic premise is that the more references some word or phrase gets, the big font is. And so she ended up doing this by hand in Publisher using a key that she made up. But you can also use, there's tons of word cloud generating websites out there. One of them is Wordle, Wordle. But basically the concept is the more times people said something in the input wall, the bigger it is. And so you can really see that visually. Other thing that I really like about the word cloud presentation is that quite often qualitative data, and this is just my anthropologist hat that I'm going to talk from for a second, qualitative data is not really meant to be quantified, and there's this in a lot of people to count up the number of people said something and show it a percentage or something like that. And I just really feel like that doesn't, that's fine, but it doesn't, it makes it more authoritative than it really is. And so by just seeing it visually, it kind of gives you the impression of how many times people said something, but it doesn't, there's no numbers associated with this, basically.
I'm giving you a high five, Anne.
Sure.
Yeah, that's awesome, and I think such an important thing to keep in mind about how to handle qualitative data, but I think I interrupted you.
I was just going to say that's all, and if folks need information, I'm sure Susan would be happy to share more information about what she did, but basically it was just assigning a 24-point font, if there were 10 responses said something or other. So it was pretty low key the way we designed it.
And thank you so much for sharing your work. You can see just within this image what you were able to hear and learn from your from community members through this information gathering activity, and the way that you presented it is really nice and gives a very visual, clear sense of what community members were communicating. So thank you for doing that. Thank you for sharing your story about how BEDHD approached this particular type of data collection. Are there others who are willing to share their stories, or does anyone have a question that would like to pose about the community input wall idea? So we are still hearing some hold music. So we're going to mute and ask you to type in the comment box if you have a question or if you have a story to share. We'll just give it a minute to do that. Question for Anne. Ask Anne how much participation or input they received from the community in terms of rough numbers for each type of, each type of wall that they did. So, you get that question?
So the one that did the analysis, I'm probably not the right person to answer the question, but I'll try to answer it anyway, which is it really varied. So for some events where we were, so an example, we were in Olivet, which is a small town in county, health fair, and, you know, there was maybe 100 people there, and, you know, we'd maybe get 15 to 20 responses for the 3 questions that we had. Contrast that with, you know, some big events we had, where we had it up for a long time at a hospital or some other body where you had a lot of people and you had somebody really excited about the project, and, you know, you could get, you know, 30 to 40 to 50 responses for each question. So I think that between all of the different locations that we took it to, we had, you know, a good diversity of locations, a good diversity of people participating, and a good, you know, good representation of people from across the 3-county area, which was really important to us. And the things that people are writing on little pieces of paper, or they're not really long, so you know, we took what people said and that into a short phrase. So, for example, if people said, you know, I really think there needs to be more parks where I can swing with my kids, then they'll go into the parks, you know, parks and recreation phrase or something like that. So, so it's like too terribly difficult to analyze it, even though you got a lot of, you might have responses.
That's a really good tip. We have a follow-up question about, was one type or method more productive than the other?
It was, yeah, so it definitely makes a difference when you have, when you get people's attention and you can pull them in, not distracted by something else. So if people are waiting or looking to interact with you, that's going to be more successful than if they're for some other specific purpose and you're distracting them from what they were planning to do. An example, we had a local hospital does a telethon, and we set up a foot wall there, and people either watching the telethon or they were waiting for their chance to get on TV, and so it was really hard. It was really hard to get them to give us input at that event. I mean, we got some input, but it was really hard. Versus at health fair or something, people are coming up to you, they're looking to interact, or even in a lobby where people are milling around without much to do. It's definitely a lot easier.
So they're in a situation where you know people are going to have time to respond.
Definitely.
Yeah. Okay, awesome. Thank you. I think we will move on and talk about our next example of INTERCEPT survey. So again, the idea is not that you would use each one of these methods, but that you would choose one to begin with and stick with just one if that's what you have time to do, and build from there if you have time for more. So the concept of an INTERCEPT survey is it's a quick, pretty simple way to gather opinions on a targeted topic from many people. And they're especially helpful when you have a very straightforward question or set of questions that most people can answer pretty readily and pretty easily. In order to conduct an INTERCEPT survey, you begin with just developing a short set, and it really is a short set, maybe 3 or 4 quick open-ended questions that can be asked of community members or clients during a very quick chat. So with the method, you are literally stopping people on the street or at a health fair or at a clinic and saying, can I ask you just a couple questions? So it really does have to be a short set of questions that they can answer really quickly and kind of get on with their day. To use this method, you print the questions with enough space to write in answers and bring them to events or places where families can be found, where community members would be. You approach potential participants with a quick spiel describing your purpose and ask if they'd be willing to share their ideas. And if they're willing, ask the questions, jot down their answers, and thank them for their help. This is one of those things that sounds like it's intimidating in a way to do or a little bit frightening to do. Really, when you get into it, it's pretty fun and pretty easy to do. Most people are pretty willing to talk about their community, to talk about what makes them healthy, to talk about what could be better about their community, make families more healthy. Those types of things are pretty accessible for people to talk about. So at least in my experience doing these, people are pretty willing to talk, and even if they're not, it's not too terrible. So we have a quick little video to show to break my talk a little bit and illustrate kind of how easy it is to do this sort of activity. We're fingers crossed that this is out okay. Show inside of the. Should. Okay. I don't know why there's no sound. Even when music can be a little bit different when it's live, right?
I can write in the PowerPoint, though it came right up. Yeah. I didn't have to go to.
I can try writing in the PowerPoint.
PowerPoint.
One second, we'll sort this out. You have a little bit more background on INTERCEPT surveys. So again, I just want to reinforce that idea that as you're thinking about your questions, it's important to think of questions that community members can answer pretty readily. You don't want people to feel caught off guard or put on the spot. So it's kind of straightforward questions that everyone's going to have sort of an opinion or experience about that they can speak to. And the questions that you ask can be focused on a variety of different things. If you are wanting to ask questions kind of broadly about community health, you can focus on those questions are pretty straightforward to come up with. And if you want to, you can also focus on particular topics. So if you wanted to focus more on breastfeeding, for example, you would, of course, want to target a location where you would find breastfeeding mothers, or focus on your WIC clinic or a setting of that nature, and target your questions around that sort of experiences. We are going to be posting resources across all of these methods on the Point site by the end of the week, so we'll have some examples. See if this works. No, I haven't shared this. Their whole music. No, it's not. I think that this is not working really well right now. So that's okay. We are going to keep moving forward with our next example. Sorry about that. They're really good videos, so we'll. What's that?
Did any local health departments do that? Share?
So has anyone conducted INTERCEPT surveys that would be willing to kind of talk about their experiences with that method? And ask you to type in your response in the box, since we're still hearing the whole music in the background when we unmute everyone. I think I'm gonna keep moving through the presentation.
Yep.
Okay, thank you for. All right, let's move forward and talk about photo voice. Photo voice is, those first two methods are pretty simple, pretty straightforward. Photo voice is a little bit more in depth, but we wanted to share it, especially because we think it's a really powerful way to get feedback from, especially adolescents. If that's a group that you want to hear more from, it can be a very powerful and accessible way for a younger group of people to communicate about their experiences. But it's helpful for all age groups. It's a really neat method if you have a little bit of time to work your way through it. So it's a great way to explore the experiences and perceptions of community members in a way that focuses not so much on language, but more on images. What does a community look like, and how can you express how you feel about your community through images, through photos? It's especially helpful with people in groups who might be less comfortable talking about their experiences without the opportunity to reflect. So for some folks, coming into a room and being asked a series of questions about health might not give them the opportunity that they need to kind of think about what you're asking them and give meaningful responses. And a photo voice sort of approach can give that opportunity for reflection and kind of get deeper into people's thoughts and experiences within their community. This is definitely one where we'll post resources on how to do it on the SharePoint site by the end of the week, because it is a little bit more in depth. Just to kind of give you a sense of if this is a direction you would want to take, I'll talk a little bit through how to conduct a photo voice project. Then we'll get another example from on what they did in their community. Photo voice involves identifying a group of community members who are coming from a particular perspective. So you might include adolescents, you might focus on teen parents, children with special health care needs, for example. It'd be a variety of groups, but you just kind of like when you do a focus group, you want to probably focus in on a subgroup of your population. The first step in the process is really holding a photo voice orientation with that group of folks. You're going to ask them to show the group what the community looks like through their eyes, give them a couple prompts around what to capture images around, and ask them to take photos that reflect their response to the questions that you posed. They will take photos, they could take photos on their phone if that's an option. You could also provide disposable cameras that they can use and return back to you. So they'll take photos that are illustrating aspects of their community that helps them stay healthy, or aspects of their community that put their health at risk. You'll want to give them a week or two to take pictures. Then they'll turn their photos into you, and it'll be important on your end to keep straight, who turned in what photos. And if they're taking photos on their phone, you can use like Shutterfly account. You can do a variety of things to capture, to collect those photos electronically. Once photos are turned in and developed, if that needs to happen, you'll bring it back together and ask each person to choose a few pictures that best represent their answers to each of the questions. And you'll ask the group to go around and talk about their pictures, talk about why they took them, what they mean to them, and how they answered the questions that you posed about health. While that's happening, you'll want to have somebody available to sort of transcribe, to keep notes on what those answers are and what pictures they're connected with. And you'll review the documentation and the photos for themes and bring those themes back to the group who took the pictures to check your understanding, to make sure you got it right. So with that brief overview, I'd like to track over to Anne to talk about the photo voice project that they did for Barry Eaton.
Can you?
Yep, thank you.
Okay. This is part of the Healthy Capital Counties project, and folks that are interested, go to the healthycapitalcounties.org website and look at the thing. We were really lucky to have Jared Madden, who is now on on this project. So maybe Erin wants to talk, I don't know, but we actually did this for us in partnership with Holly, Mac, and Eaton Risa. So we have partners in the education world that are really used to working with students and kids. And we felt like it was really important that we get voices from youth in health assessment in this round because we hadn't before. And so Holly has access to students and could organize that. And then Erin, had the millennial kind of outlook and understanding of things like Instagram and how the youth would be interested in participating. And so when we organized this project, it was done partially through Instagram, which really appealed to the youth. And then I think also lent a lot of authenticity to this project. All I have to say about it.
Thank you. I want to invite anyone who has questions about Photo Voice or about Anne's example to go ahead and post those in the box, and we'll keep an eye on there. I'm not sure how well you can see the example on the screen, but it kind of shows how those images are pulled out of Instagram and how the hashtags are used to kind of present findings and summarize findings in a very friendly way, we'll say. Erin, do you want to add anything? Oh, go ahead.
Oh, I'd say, we did a bit of analysis on this. So it might look like, oh, we just took the pictures that the kids posted, but a lot of thought that went into it. And really cool is there was some things that they took pictures of and were really important to them that we had no idea. So the environmental quality was a big issue for them, and for the adults, it wasn't, but for the kids.
And that's important to have that opportunity to hear from groups present different pieces of the life course and different experiences with their community. Thank you for sharing that.
Yeah, Erin speaking now, but Anne, I think you did a great job summing all that up, and I'm glad that we provided some of the pictures here from the actual report, because I really liked this concept of Instagram theme. Traditionally in Photo Voice, you see the photo and then the caption underneath it, whatever way you want to display it. But I thought just because we were using the perspective, it would be cool to have a youth-centered social media platform displayed here. And so I don't know how many of you are familiar with Instagram, but the top, if you just take one of these picture examples, you can see where your name would normally be, or your, I guess your field, what they call it. That's where we have Capital County's Photo Voice up there, and then underneath you have the location. So it's the actual location from where these photos were taken, whether it was Mason or Lansing or Charlotte. You have the photo there, and the caption is where you would normally write your caption on Instagram. And then, yeah, like Julia said, we use the hashtag to the themes that we found, and a group of us at Barry Eaton all got together, and I don't remember how many photos we had total, but it was 100 or so, maybe more, and then narrowed it down. Took a couple hours to, put them into the theme we wanted, and that's how we wanted to display the work. So
the captions were created by the person that took the picture?
Yep, they wrote their caption down, which they thought about after they took the picture. They took the picture and thought about, where can I go with this, and then they wrote the caption afterwards. And we had a session to help them think through what's important in caption making. Yeah.
Thank you. Questions or experiences with Photo Voice that you'd like to share? I mute everybody, but we are paying very close attention to the comment box.
Yeah, I'm wondering if our colleagues, anybody on the west side of the state, I remember seeing a Photo Voice example, and I apologize, I can't remember where it was, but so if you did a voice on the west side of the state and you want to share, I appreciate it. This is Trudy. You need to chat in who it is, though, so we know who to unmute.
Again, Anne, for sharing that. Oh, there we go. C10. We are going to find you and unmute you right now. Just one second.
Hello.
Hi. A little bit about your photo voice for that.
So the link is there, so I don't know if everyone else can see it as well, but it was we put it up on YouTube. Basically, when we did our photo voice, it was again with youth, like you guys discussed, and it was about the HPV vaccine. So we were really trying to figure out a way. We did the photo voice basically as a problem solving. I think we wanted to the youth to go out and figure out why they weren't getting the vaccine, why their parents maybe weren't advocating for the vaccine, things like that. So it was very youth-driven. They created the entire photo voice. They edited the entire thing and put it together. And it was a really fun experience for them. They had fun going out and taking the pictures. Yeah, they came back with a lot of the stuff that we already know about HPV, but it was nice to kind of see it through the lens of a teenager.
What takeaways?
One was it's not successfully promoted through their primary care provider. There's a lot of conceptions with the HPV vaccine and maybe what it's going to lead to in regards to promoting sexual activity. And it's very heavily associated with sexual activity instead of cancer prevention. And, you know, the problem with every vaccine, and that was the anti-vaccine individuals who are against any vaccine. But those were the big ones that came out of their photo voice. Also, that it's not really promoted to boys. They heard a lot about how young girls should get it, but they didn't hear a lot about how young boys should also receive the vaccine.
That's interesting. Thank you for sharing. And could you speak a little bit to sort of the time investment for health department staff in completing it?
Sure. I mean, for us, it was kind of easy because we have a youth coalition already. So we were able to utilize our coalition in Oceana County, which is on the west side of the state. So we really just piggybacked off of those meetings and made kind of one projects that they could focus on, and they were able to kind of volunteer to work on the project. As far as time commitment, it wasn't a lot on my end. It was more checking with the youth, making sure I knew what they needed to do. I put together like an entire packet and help them kind of walk through what they were supposed to do with some thought-provoking questions to make them, because I want them not only to take pictures, but to explain what those pictures represent in their own words. So there was a worksheet that they worked through to kind of come to a consensus on what that picture represented. But as far as, you know, the time that I had to put in, it wasn't significant. Because I had an existing youth coalition. Now, if you didn't have an existing youth coalition, you know, you could partner with another agency potentially that does and work with them. Or if you have a good relationship with the schools, you could just contact the schools.
The idea of connecting it with something that you're already doing, that a group that already exists, really creating some efficiencies there is that's really smart. Thank you for sharing that. Mm-hmm. And it sounds like that you put together maybe some good tools, and if you or really anyone on the line has those sorts of tool resources that you've put together that you wouldn't mind sharing, that I think is a really nice use for the SharePoint site. If you're willing to share and could send them to us, and we'll put them up for others to take a look at and see if they can borrow from your ideas if you're comfortable with that. Thank you. Other questions about photo voice or stories to share? Well, thank you very much to Ann and Milani for sharing, and those are both really exciting projects and great, I think, for the group of us to hear about, so thank you. Next method that you might think about using is probably a very familiar one to many of you, of a focus group. So the nice thing about a focus group is that it brings people together around sort of a common question in a way that allows people to build off of one another's ideas and comments. So you're kind of getting that, not just the interaction with the interviewer, the person asking the questions, but that group interaction where people are responding to what they're hearing, and sometimes that helps take the direction into take the conversation a little bit deeper or into an unexpected direction. It's also a pretty quick way to get multiple perspectives on a question, and provides opportunities for focus group participants to speak to and share their experiences. They're especially useful if you have a focused topic that you want to explore. So if you want to talk particularly about behavioral health or access to health care, developmental services, or any other sort of specific focus topic, it can be a nice way to do that. Or it can be a good way to focus around a specific targeted group or phase of the life course. So it can be a nice opportunity to hear from first-time parents or mothers who are recovering from substance abuse. So if there's a population that you know aren't going to be well reflected within your population health data, a focus group can be a nice way to bring them together and hear about their experiences. So to the focus group, you'll bring together a small group of community members to respond to a specific set of questions. Focus groups will require you to have a facilitator who can keep the group focused on the questions, focused on the topic at hand, and make sure everyone has an opportunity to share their perspective. You'll also need to have a recorder who can take notes. So it is really important to have both of those roles covered if you are conducting focus groups, both your facilitator and your recorder or your note taker. You need to have a small set of open-ended discussion questions that will guide the conversation. 5 to 8 questions is a good target. If it's too many, a focus group will go on for a very long time, so you have to kind of keep it limited. When the focus group comes together, you want to have an introduction that shares the intent and purpose of the focus group, a way to introduce participants to the facilitator and note taker and to one another. And you'll also want to make sure they incorporate language about encouraging participants to keep the conversation confidential. Of course, that's not something that you can control, but it's certainly something that you can encourage and suggest as appropriate to the group. The facilitator will keep the conversation on track, keep the conversation moving forward, while also making sure that they remain neutral and encourage varied opinions. It can be really tempting as an interviewer or a focus group facilitator to reinforce comments, to say, that's great, for example. But the facilitator has to practice the use of sort of neutral language skills, that's interesting, instead of that's great, for example, to try to make sure that they are showing that they're listening without demonstrating that they are in favor of particular ideas or value particular ideas over others, to make sure that there's space for multiple perspectives. It's appropriate to try to keep a focus group to an hour, maybe an hour and a half at most, but if you're bringing together members of your community, parents, busy people, it's probably a good idea to try to contain the conversation to an hour. Before you conclude the conversation, it's important and valuable to summarize the main theme that you heard and to ask the group if there's any important ideas that you missed. One of the key principles of qualitative data collection is called member checking, the idea of saying, this is what I think I understood from what you said, is that right? And with a focus group, you don't have that opportunity necessarily to bring people back together, so it's a good practice at the end of the conversation to say, these are the things that I heard throughout this conversation. Does that cover it, or did I misunderstand anything, or is there anything else that you think is really important for me to capture? So save the last 5 minutes for that sort of wrap-up conversation is a good practice. We have another video. We are going to keep our fingers crossed that this one works to illustrate in kind of a silly way what a focus group can look like. Looks like still having trouble with. There we go.
Can you tell us some in here today? We're having a focus group for Let's Move, and we wanted to get your opinions on how you think we can get kids like you to be healthier and to get more exercise. I've got a friend, Will, who's going to ask some questions too.
We're going around a long time.
Can you tell us some of your favorite fruits and vegetables? Strawberries. Okay.
Let me guess, cabbage?
No.
Oh.
You like bananas?
I like to get back to Diet Cola, is that a vegetable? What's so funny? You know, you're funny. Is there one trick to having a great beach bod for the summer, getting healthy?
It's about tricks. Getting a good body and staying healthy is about dedication and consistency and eating right.
So, no entire honey baked hams.
All right. Tell me, what kind of music do you like to dance to?
My favorite is Body Moving.
Body moving.
Body moving, make our sound so soothing.
Good. Body moving.
DJ. What if you guys, for your lunch at school, had a krill oil supplement sandwich? Does that sound good?
No.
We'll take our oil
Supplement.
If we eat a great diet, 6 a week, but on Sunday I eat nothing but candy, is that okay?
No.
What?
It could get you a little bit sick.
So I'm going to stop doing it. Yeah, oh yeah. For about 2 years now.
One last question. We want to know what kinds of celebrities you like. So tell us, who's your favorite comedian?
Jim Fallon. That's mine too. Because I watched this and I do.
Anybody else?
Yeah, anybody else? You're lucky to ask them who their favorite first lady is.
Hope that was that came across everybody. Just a cute example of a focus group that I think illustrates some of the things that I mentioned at the beginning. I think we saw there that Will Farrell is a terrible focus group facilitator. You know, one of the things that I think is really important to keep in mind as a facilitator is that you want to make sure that your responses are very neutral, and we saw that his responses were not particularly neutral in the video. You want to make sure as a facilitator that your input is fairly limited into the conversation, that your role is to ask questions and to probe for more information, but not necessarily to share, certainly not to ask leading questions, which, you know, we saw that he did a bit of. And also, of course, to pay attention to the comfort of the group and to think about how you can make sure everyone in the room feels like their perspective and voice is valued and an important part of the conversation. I think another thing that we saw illustrated in a humorous way within the video is the difference in response that you get when you think about asking an open-ended question, like what kind of music do you like to dance to? Opens up the door to a response other than a yes or no, right? That gives folks a chance to think about and talk about what their preferences are. And you kind of saw that in contrast to the question about the smoothie, and the question was, does that sound good, which is a yes or no question, and you heard the no response, but not any sort of deepening of that conversation. So anyway, a silly example, but one that I think illustrates sort of the some of the key points in focus group facilitation. I would love to hear from anyone else who has experiences conducting focus groups with community members, or any questions that you have about focus groups or focus group facilitation. And again, you could ask your questions or share through the chat box. That would be great. I am very shy today with the invited attendees that we have in the room. It is a little intimidating, but I think that the sharing is such a nice way to learn from one another if you're willing to jump in there and talk about your experiences. Well, we have one last example to share with you of a way to hear from community members and community partners, which is a town hall or a community meeting. I know that lots of you have experiences doing this or participating in these. The idea is that you bring a large group of people together for an open discussion. These meetings are usually intended to be inclusive and, again, large. You could have 60 people, 100 people in the room, and would represent various members of the community, sectors of the community. You could hold multiple town hall or community meetings. You could, if that was an appropriate thing for your community, or if you are a multi-county jurisdiction, you could do one in each of your counties. These meetings require a strong facilitator and a recorder, and they should be guided by a facilitation plan. And what we'll do is provide examples of a plan on, again, the SharePoint site by the end of the week. But this is, the town hall meeting is a fairly quick way to get input from a broad group of people, through a very sort of inclusive, everyone can come, everyone is invited sort of method. Okay, so again, to summarize, oh, I have a question pop up? Oh, thank you. We got a really important comment about focus group planning, which is that it's very important to select a location in a thoughtful way when getting participants from across a city or county. So the health department might be a great location, but it might not be the best location or the most accessible location within a community. So thinking about how participants are going to get there and how much time it will take, and also how much resources it will take, or how easy it would be to get there is a really important point to consider. Thank you very much for that comment. We're asking that you select one of these methods to gather community input. And if you can, to select more than one, or to do one of these things in more than one setting or with more than one population, if you can. But again, the expectation or the ask is that you select one. And once you are finished with gathering your data, it'll be time to summarize it. So in the context of the tool, which again we'll send out after our conversation today, you'll answer a couple questions. You'll tell us about the method that you chose, or the methods that you chose. You'll tell us about the participants that you targeted, their characteristics, and how many and why. In some cases, the how many might be an estimate. So for a community input wall, for example, or a town hall meeting, you might not have the exact number, but that's okay. Just kind of an estimate of how many individuals were engaged. I also ask you to talk about the information gathering tools you used. So what was the focus group protocol that you used? What were the interview questions that you used? And we'll like you to describe the processes that you used to gather information. So if you facilitated a focus group, tell us about what that focus group looked like, how you implemented it. So you'll just be describing the methods that you chose. As you start to think about the method that you want to use and develop your protocol for that method and think about how to engage people and all of that, if there's any question that we can answer, any support we can provide, we're happy to do that. If you want us to help come up with interview questions or focus group protocol, that's what we're here for. So please don't hesitate to reach and ask for our help with those pieces as you get those developed. Then we will have examples on SharePoint that you can go to. So once you have completed this piece of collecting data and summarizing how you did it, the tool will guide you through the process of organizing your findings by each of the methods that you chose and indicating if your finding reflects an opportunity for improvement or a community strength. So what we'll ask you to do is summarize findings in a series of bullets that'll either be about a strength or an opportunity for improvement. And we're trying to think about how to do this in a really straightforward way. Qualitative data doesn't tell us, concrete facts about what's going on within a community. It gives us ideas, it gives us direction, it gives us a sense of what's going on. So we're not asking you to say our high rates of deaths within our community, or parents are not engaging in safe sleep practices. We're asking you to say things more along the lines of the moms that we spoke with young babies are having a hard time figuring out how to follow safe sleep practices and also get sleep themselves. Things along that nature. So it's sort of a broad statement of the theme, the idea that you heard from whatever method that you engaged in. So within the tool, you'll write a series of sentences like that summarize the main findings, the main things that you heard, the themes that you heard across the method that you used. We'll ask you to try to keep your description to a sentence, but include in that sentence enough detail that anyone would be able to tell who and what the finding is about. So you'll want to say who with young children, and then the what of are having a hard time figuring out how to follow safe sleep practices and get sleep themselves. So we want it to be deep enough that when we read it, we understand what the finding is and who it's about, but not so detailed that you're feeling like you have to write pages and pages about each idea. So it's really a sentence that describes the theme that you saw in your data. We would expect that each method would identify multiple opportunities for improvement and multiple community strengths, so we would expect that you would have a series of methods in each of those columns. And so we're going to show, submit an example of what that table looks like filled in. Tips on handling qualitative data. So as you're looking at your cards from your community input wall, or your notes from your focus groups, or the captions that were written about your pictures, we want you to pay attention to a couple of things. We want you to pay attention to ideas that came up multiple times. So you saw in Anne's example how they kind of counted up the number of times that different phrases appeared on the community input wall. So how many times were people talking about access to care? How many times were people talking about parks and recreation facilities? How many times were people talking about different things? And just to get an idea of what is coming up a lot for people. That doesn't necessarily mean it is the most important thing to people, that it's the most important thing to a community. It just tells you that for when asked sort of this broad question, for a lot of people, this was one of the first things that came to their mind. We want you to also attend to unique or innovative ideas. So you asked a broad question, a lot of people might think about, about health. People might automatically think, well, it's really hard to get an appointment with my doctor, so you're thinking health, doctor, that's the first thing that comes to mind. But you might have somebody within your community that that responds to that question in a really unique or surprising or enlightening way. You want to incorporate that into your thinking about your findings as well, because other people might have that same idea or perception if they were asked about it directly. It just isn't necessarily the most obvious response to a question. So pay attention to those unique or innovative ideas that come up. To the extent possible, depending on your method, it can be helpful to notice differences in perspectives between different people or groups of people. So an example of this is if you're conducting focus groups within a community and you have those focus groups around different groups. So you're doing focus group with adolescents, you're doing a focus group with young mothers, you're doing a focus group with the parents of children and youth with special health care needs. It might be helpful to notice what are the unique things that each of those groups are bringing out that were different from one another. The other thing that we would ask you to do is focus on the why, the meaning, what's underlying the comments and the ideas that people are bringing up or bringing to the table. It's, of course, there's more opportunity for this sort of thing in one of the more intensive methods, like if you're doing focus groups or you're doing a photo voice project, to get to the why. And to the extent that you can do that, it's helpful in thinking about where your next steps might be if you can kind of get to the those underlying perceptions or needs. This is an example of the table that you'll fill out within the tool, and this is then based on some of the findings that out of the example that Anne shared for the community input wall and the photo voice project. So the input wall, opportunities for improving maternal child health, increased access to health care, new parks and recreational setting, increased children and family support. See some opportunities for improvement. Then under community strengths, large hospitals in the community and surrounding area, large fitness center and spa in the Charlotte area, community parks that offer walking trails and playgrounds for children. So we share this just to illustrate that we're not asking for a thesis on each of these methodologies or a large report, but would like you to go through and tell us what are those main themes, those main ideas that you saw, those innovative ideas that you saw, those ideas that tell you the underlying issue, the why within your community, and to bullet those out in the context of this table as a way of summarizing your findings. And a note before we move on, all the infos that we're sharing in today's webinar are going to be uploaded to the SharePoint website in the document section, as well as resources on each of the methods that we talked about today. And anything else that anyone on the line or that listens to the recording afterward is willing to share. I know that you've all developed really great tools and have lots of experience gathering data in these ways. I'd love for you to have that to learn from one another. So if you can send those to us if you're willing, then that would be great. And with that, I'm going to ask for any questions that you have or any additional stories that you'd like to share today. Mute everyone again. Oh, still have the hold music. So we're gonna mute again and ask you to please respond in the chat box if you have questions or if you have any to share. Mm-hmm. Next, document due. That is a great question that we have coming right up. Well, let's just jump ahead to that. What's that? So completed steps 4 and 5 will be due by June 23rd. That will include all of your assessments, completed assessments, not just this first one, but you have several months to move through these three assessments. If you'd like us to look at anything before then, would be more than happy to do that. So please send these as you're completed with them, and we'd be happy to look at it and provide any input that we might have. But the 9th is June 23rd. Webinar is March 9th from 1 to 3, and we'll be going through the maternal child health status assessment at that point.
That receive the time and attention it deserves.
Questions this afternoon? Any comments or feedback from folks in the room?
What Julia has said, I've seen some examples of some of the tools that she shared with you today, the photo voice, for example, groups, and it's really exciting work. So I think it will be fun for you. I hope it will be fun.
Well, we didn't see any questions come in on the chat box this morning, but we invite you, of course, to ask any questions that you have after the fact. Again, we'll have some resources posted. Oh, we do have a question. More than one method to gather information, correct? For instance, we have a focus group for children's special health care, but I'm afraid the focus may be too narrow, so would it be better to include another process? Absolutely, you are invited and encouraged to use more than one method to gather information, you know, and especially if you are wanting to focus on specific population groups, you know, the results will be very specific to that group or to that health area from those sort of activities. So if you can include more than one, or a broad one and a focused one, or multiple focused ones, that would be awesome, and really encourage you to do that, you know, to the extent that you have the time and space to do so. Question, thank you. We are watching the chat box carefully. But if you have questions after the fact, please reach out to us and we'd be happy to answer them. We'll have some resources posted on SharePoint by the end of the week. Example focus group protocol, example INTERCEPT interviews, example guidance for doing input wells, that kind of thing, just to get you started. And if you want our assistance modifying any of those things or in coming up with questions, we're more than happy to do that. Again, that's what we're here for, so don't hesitate to reach out to us as you get going with this. We cannot wait to see what you come up with. We can't wait to see what you learn, and we hope that this is a good and informative experience for you. And please let us know what we can do to help ensure that that's so. I'm not seeing any other questions, so I think that we are going to wrap it up for today. Have a very happy Valentine's Day, and don't hesitate to reach out if you need anything at all. Take care.